Whether it's watching a movie or watching your family, seeing clearly is important to all of us. If you find yourself struggling, well, we have help today. Joining me is Dr. Jaime Gaitan from Associated Retina Consultants, and he has tips for us today. Thanks so much for talking with us.
First of all, thank you for having me here today to discuss this very important topic with you and our viewers.
Yeah.
So macular degeneration is one of the leading causes of blindness in the United States in our aging population. It is a condition that affects the back of the eye, the macula, which is that part of the retina responsible for your reading vision, for your central vision, for your ability to make out fine detail. So macular degeneration comes in two forms, basically. There's a dry type and there is a wet type of macular degeneration. Dry macular degeneration is the more prominent form. It affects the majority of patients with macular degeneration. The wet macular degeneration affects about 10% of the patients with this condition, and it is responsible for the more rapid form that causes vision loss.
Now, a lot of people have probably heard about macular degeneration. They're probably nervous about it, scared about it. What are some of the risk factors for getting it?
So the main risk factor is age. So the older you are, the higher the risk. But other risk factors include a family history. So if you have several first-degree relatives with this condition, that puts you at risk. Whether people realize it or not, smoking is also a risk factor for macular degeneration. In fact, patients that smoke have at least a twofold risk of developing macular degeneration. So if you have risk factors for macular degeneration, one of the first things that we encourage is smoking cessation. But there are other risk factors, including higher body mass index, we said family history, and other risk factors include race. Actually, race is also a risk factor.
So let's talk about treatment. If you find out you do have this, what are some of the options now?
So about 10 years ago, there was really a revolution in the treatment of the wet form of macular degeneration. Like I said, this causes the more rapidly active form of macular degeneration. So there are these injections that were developed that block the blood vessels that cause wet macular degeneration. These injections are administered about once a month into the eye, and they block the growth of these blood vessels that cause bleeding and scarring and irreversible vision loss.
Now, just a few weeks ago, there was an article about a new treatment.
Well, so actually, this is one of the main reasons I wanted to talk about macular degeneration today, and that is that there was an article published in the New England Journal of Medicine describing 3 patients who were receiving stem cell therapy, and unfortunately, these patients had almost complete vision loss. So what happened is, what's happening now is that you're seeing these stem cell clinics kind of sprouting up all over the country, and in this particular situation, these patients paid a substantial amount of money up front, in this case,
and you say there wasn't
$5,000.
Yeah.
And one of the red flags was that both eyes were treated at the same time. So you have to be really, really careful.
So think about that. Be careful, everyone. Retina Consultants, of course, tell me more about Associated Retina Consultants really quick before we go.
So Associated Retina Consultants is one of the largest retina practices in the country. We're a very academic practice. We're involved in many FDA-regulated clinical trials, and we also have a training program where we are training 2 fellows to become future retina surgeons.
And everybody, you can call, make an appointment, get a consultation with them. All you have to do is visit AssociatedRetinaConsultants.com or call the number right there on your screen.